Situation 9. It is the first day of clinical experience of nursing students at the psychiatry ward. During the orientation, the nurse emphasizes that the team members, including nursing students, are legally responsible to safeguard patients' records from loss or destruction or from people not authorized to read it. Question 41. It is unethical to tell one's friends and family members' data about patients because doing so is violation of patients' rights to A. Informed consent. B. Confidentiality. C. Least restrictive environment. D. Civil liberty. Answer: B. Question 42. The nurse must see to it that the written consent of mentally ill patients must be taken from A. Doctor. B. Social worker. C. Parents or legal guardian. D. Law enforcement authorities. Answer: C. Question 43. In an extreme situation and when no other resident or intern is available, should a nurse receive telephone orders, the order has to be correctly written and signed by the physician within A. 24 hours. B. 36 hours. C. 48 hours. D. 12 hours. Answer: A. Question 44. The following are SOAP, subjective, objective, analysis, plan, statements on a problem, anxiety about diagnosis. What is the objective data? A. Relate patient's feelings to physician, initiate and encourage her to verbalize her fears, give emotional support by spending more time with patient, continue to make necessary explanations regarding diagnostic test. B. Has periods of crying, frequently verbalizes fear of what diagnostic tests will reveal. C. Anxiety due to the unknown. D. I'm so worried about what else they'll find wrong with me. Answer: B. Question 45. Nursing care plans provide very meaningful data for the patient profile and initial plan because the focus is on the A. Summary of chronological notations made by individuals' health team members. B. Identification of patients' responses to medical diagnosis and treatment. C. Patients' responses to health and illness as a total person in interaction with the environment. D. Step procedures for the management of common problems. Answer: C. Situation 10. Marie is 5½ years old and described by the mother as bedwetting at night. Question 46. Which of the following is the most common physiological cause of night bedwetting? A. Deep sleep factors. B. Abnormal bladder development or structure problems. C. Infections, familial and genetic factors. Answer: A. Question 47. All of the following, except one, comprise the concepts of behavior therapy program. A. Reward and punishment. B. Extinction. C. Learning. D. Placebo as a form treatment. Answer B. Question 48. To help Marie who bedwets at night practice acceptable and appropriate behavior, it is important for the parents to be consistent with the following approaches except A. Discipline with the king attitude. B. Matter of fact in handling the behavior. C. Sympathize for the child. D. Be loving yet firm. Answer A. Question 49. A therapeutic verbal approach that communicates strong disapproval is A. You are supposed to get up and go in the toilet when you feel you have to go and did not. The next time you bedwet, I'll tell your friends and hand your sheets out the window for them to see. B. You are supposed to get up and go in the toilet when you feel you have to go and you did not. I expect you to from now on without fail. C. If you bedwet, you will change your bed linen and wash the sheets. D. If you don't make an effort to control your bedwetting, I'd be upset and disappointed. Answer D. Question 50. During your conference, the parent inquires how to motivate Marie to be dry in the morning. Your response, which is an immediate intervention, would be A. Give a star each time she wakes up dry, and every set of 5 stars, give a prize. B. Tokens make her materialistic at an early age. Give praise and hugs occasionally. C. What does your child want that you can give every time she wakes up dry in the morning? D. Promise him her a long-awaited vacation after school is over. Answer A. Situation 11. The nurse is often met with the following situations when clients become angry and hostile. Question 51. To maintain a therapeutic eye contact and body posture while interacting with angry and aggressive individual, the nurse should A. Keep an eye contact while staring at the client. B. Keep her hands behind her back or in one's pocket. C. Fold her arms across her chest. C. Keep an open posture, for example hands by sides but palms turn outwards. Answer D. Question 52. During the pre-interaction phase of the NP relationship, the nurse recognizes this normal initial reaction to an assaultive or potentially assaultive person. A. To remain and cope with the incident. B. Display empathy towards the patient. C. To call for help from the other members of the team. D. To stay and fight or run away. Answer B. Question 53. Which of the following is an accurate way of reporting and recording an incident? A. When asked about his relationship with his father, client became anxious. B. When asked about his relationship with his father, client clenched his jaw teeth, made a fist and turned away from the nurse. C. When asked about his relationship with his father, client was resistant to respond. D. When asked about his relationship with his father, his anger was suppressed. Answer, B. Question 54. To encourage thought. Which of the following approaches is NOT therapeutic? A. Why do you feel angry? B. When do you usually feel angry? C. How do you usually express anger? D. What situations provoke you to be angry? Answer, A. Question 55. A patient grabs a chair and about to throw it. The nurse best responds saying, A. Stop. Put that chair down. B. Don't be silly. C. Stop, the security will be here in a minute. D. Calm down. Answer, A. Situation 12. Nursing care for the elderly. Question 56. In planning care for a patient with Parkinson's disease, which of these nursing diagnoses should have priority? A. Potential for injury. B. Altered nutritional state. C. Ineffective coping. D. Altered mood state. Answer, A. Question 57. A healthy adaptation to aging is primarily related to an individual. A. Number of accomplishments. B. Ability to avoid interpersonal conflict. C. Physical health throughout life. D. Personality development in his lifespan. Answer, C. Question 58. The frequent use of the older client's name by the nurse is most effective in alleviating which of the following responses to old age? A. Loneliness. B. Suspicion. C. Grief. D. Confusion. Answer, D. Question 59. An elderly confused client gets out of bed at night to go to the bathroom and tries to go to another bed when she returns. The most appropriate action the nurse would take is to A. Assign client to a single room. B. Leave a light on all night. C. Remind client to call the nurse when she wants to get up. D. Put side rails on the bed. Answer, A. Question 60. An elderly who has lots of regrets, unhappy and NBSP, miserable and NBSP, is experiencing A. Crisis. B. Despair. C. Loss. D. Ambivalence. Answer, B. Situation 13. Graciela, 1.5-year-old, is admitted to hospital from the emergency room with a fracture of the left femur due to a fall down a flight of stairs. Graciela is placed on Bryant's traction. Question 61. While on Bryant's traction, which of these observations of Graciela and her traction apparatus would indicate a decrease in the effectiveness of her traction? A. Graciela's buttocks are resting on the bed. B. The traction weights are hanging 10 inches above the floor. C. Graciela's legs are suspended at a 90-degree angle to her trunk. D. The traction ropes move freely through the pulley. Answer: A. Question 62. The nurse notes that the fall might also cause a possible head injury. She will be observed for signs of increased intracranial pressure, which include A. Narrowing of the pulse pressure. B. Vomiting. C. Periorbital edema. D. A positive Kernig sign. Answer: B. Question 63. Graciela is assessed to have no head injury. The Bryant's traction is removed. A plaster of Paris his spica is applied. Which of these findings has a concern of immediate attention that must be reported to the physician immediately? A. Graciela is scratching the cast over her abdomen. B. The toes of Graciela's left foot blanch when the nurse applies pressure on them. C. Graciela's cast is still damp. D. The nurse is unable to insert a finger under the edge of Graciela's cast on her left foot. Answer: D. Question 64. Part of discharge plan is for the nurse to give instructions about the care of Graciela's cast to the mother. Which of these statements indicate that the mother understood an important aspect of case care? A. I will use white shoe polish to keep the cast neat. B. I will place plastic sheeting around the perineal area of the cast. C. I will use cool water to wash the cast. D. I will reinforce cracked areas on the cast with adhesive tape. Answer: D. Question 65. The nurse counsels Graciela's mother ways to safeguard safety while providing opportunities of Graciela to develop a sense of A. Trust. B. Initiative. C. Industry. D. Autonomy. Answer: D. Situation 14. Jolina is an 18-year-old beginning college student. Her mother observed that she is having problems relating with her friends. She is undecided about her future. She has lost insight, lost interest in anything, and complained of constant tiredness. Question 66. Jolina is out on antidepressant drugs. These drugs act on the brain chemistry, therefore they would be useful in which type of depression? A. Exogenous depression. B. Neurotic depression. C. Endogenous depression. D. Psychotic depression. Answer: B. Question 67. This is a tricyclic antidepressant drug. A. Venlafaxine, FXR. C. Sertraline, Zoloft. B. Fluoxetine, Prozac. D. Imipramine, Tofranil. Answer D. Question 68. After 1 week of antidepressant medication, Jolina still manifests depression. The nurse evaluates this as A. Unusual because action of antidepressant drug is immediate. B. Unexpected because therapeutic effectiveness takes within a few days. C. Expected because therapeutic effectiveness takes 2 to 4 weeks. D. Ineffective result because perhaps the drug's dosage is inadequate. Answer C. Question 69. Jolina continues to verbalize feeling sad and hopeless. She is not mixing well with other clients. One of the nurse's important consideration for Jolina initially is to A. Formulate a structured schedule so she is able to channel her energies externally. B. Let her alone until she feels like mingling with others. C. Encourage her to join socialization hours so she will start to relate with others. D. Encourage her to join group therapy with other patients. Answer C. Question 70. During the pre-discharge conference, the nurse suggests vocational guidance because it should help Jolina to A. Find a good job. B. Make some decision about her future. C. Realistically assess her assets and limitations. D. Solve her own problems. Answer C. Situation 15. Group approach in nursing. Question 71. Membership dropout generally occurs in group therapy after a member A. Accomplishes his goal in joining the group. B. Discovers that his feelings are shared by the group members. C. Experiences feelings of frustration in the group. D. Discusses personal concerns with group members. Answer C. Question 72. Which of the following questions illustrates the group role of encourager? A. What were you saying? B. Who wants to respond next? C. Where do you go from here? D. Why haven't we heard from you? Answer B. Question 73. The goal of remotivation therapy is to facilitate A. Insight. B. Productivity. C. Socialization. D. Intimacy. Answer B. Question 74. The treatment of the family as a unit is based on the belief that the family A is a social system and all the members are interrelated components of that system. B as a unit of society needs the opportunity to change its own destiny. C. Who has therapy together will tend to remain together. D is contaminated by the presence of deviant member and all members need treatment. Answer A. Question 75. The working phase in therapy group is usually characterized by which of the following? A. Caution. B. Cohesiveness. C. Confusion. D. Competition. Answer B. Situation 16. The mental health psychiatric nurse functions in a variety of settings with different types of clients. Question 76. Poverty as reflected in prevalence of communicable diseases, malnutrition and social ills such as street children, homeless and prostitution is a predisposing factor to mental illness. A community approach to cope with this problem is for the nurse to support A. Aggressive family planning methods. B. Provision of social welfare benefits for the poor. C. Social action. D. Free clinics and more hospitals. Answer B. Question 77. The most cost-effective way to meet the mental health needs of the public is through programs with the priority goal of A. Treatment. B. Prevention. C. Rehabilitation. D. Research. Answer B. Question 78. Laurel upon discharge was referred to a volunteer group where she has learned to read patterns, cut out fabric and use a sewing machine to make simple outfits that will help her earn in the future. What type of activity therapy is this? A. Recreational therapy. B. Art therapy. C. Vocational therapy. D. Educational therapy. Answer C. Question 79. In a residential treatment home for adolescent girls, the clients were becoming increasingly tense and upset because of shortening of their recreation time. To de-escalate possible anger and aggression among the clients, it is best to play A. Religious music. B. Relaxation music. C. Dance music. D. Rock music. Answer B. Question 80. The parents of special children who are behaviorally disturbed need mental health education. Which of these topics would the school nurse consider as priority for their parents' class? A. Drug education. B. Child abuse. C. Effective parenting. D. Sex education. Answer C.